Good evening, dear students. I, Dr. Ami Rawal, your original guru for dental anatomy and dental histology, is here to discuss NEET Grand Test 4 questions of DADH. Right. So let's start with our first question. Occlusal morphology of mandibular second premolar is all except. It is asked what? Except. Right. So focus on this. Except. Is it H? Is it Y? Is it U? Or is it V? So mandibular second premolar has mainly two forms. 3-cusp pattern and 2-cusp pattern. It has 3-cusp pattern as well as 2-cusp pattern. So in this 3-cusp pattern mainly depicts Y form. And 2-cusp pattern again has two forms. It is H and U pattern seen on the occlusal surface of the premolar. So H, U and Y are definitely the occlusal forms. So remaining one is V here. So the correct answer here is V. Usually premolars have only two cusps, buccal cusp and lingual cusp. But in case of mandibular premolar, it will be having 2-cusp pattern as well as 3-cusp pattern. In 3-cusp, it will be having 1 buccal and 2 lingual cusp. In this diagram, you can easily appreciate. Here we can see 1 buccal cusp and this is 2 lingual cusp. One will be mesiolingual, one will be distolingual and 1 buccal cusp. So here also we can see 3 cusp type. 1 buccal cusp and 2 lingual, mesiolingual and distolingual cusp. So one groove is separating mesiolingual and distolingual cusp, that is mainly our lingual developmental groove. One will be mesiobuccal and one will be distobuccal. So this Y pattern is mainly seen with which tooth? 3-cusp tooth. So Y cusp pattern is mainly formed by the presence of the grooves. This is lingual groove separating 2 lingual cusp and 2 buccal grooves, mesiobuccal and distobuccal groove. Now coming to 2-cusp pattern. Here you can easily appreciate U pattern. Central groove is in the form of crescent shape. Central groove, this is central groove. It will be crescent shaped. And another one we can here see central groove is extending buccally as well as lingually. So it is H pattern. So in this diagram we can easily appreciate, and to be more precise, in this diagram also you can easily appreciate H pattern for 2-cusp, Y pattern for 3-cusp and again U pattern for 2-cusp. Three-cusp type mainly develops from 5 lobes. 3 lobes are involved in the development of buccal aspect and 2 lobes are involved in the development of lingual aspect. While in case of 2-cusp type, 4 cusps are involved. 3 for buccal and 1 for lingual, as there will be only 1 lingual cusp present here. Right. Here we can easily appreciate buccal cusp, mesiolingual and distolingual cusp in case of 3 cusp and buccal and lingual cusp in case of 2-cusp pattern. Y pattern is formed by mesial developmental groove, distal developmental groove and lingual groove separating 2 lingual cusp. While U and H pattern are mainly formed by central groove. Now coming to our next question, that is from dental histology. Which of this is the inner lining of calcified dentinal tubules? It is asked, inner lining of calcified dentinal tubules. Is it lamina lucida? Is it lamina densa? Is it lamina propria? Or is it lamina limitans? So from this option, you can easily say that lamina lucida and densa are parts of basal lamina. They are parts of basal lamina. So this is not the correct option here. Basal lamina has mainly three parts, right? Lamina lucida, lamina densa, and last one is fibroreticularis. Fibroreticularis. Lamina lucida is the clear zone, lamina densa is the middle layer, and fibroreticularis is present near the lamina propria. Coming to lamina propria, it is the connective tissue portion. So this is also not the correct answer. Here we are talking about dentinal tubules. These are not part of dentinal tubules. So the correct answer remaining here is our lamina limitans. Lamina limitans is mainly thin organic lining present on the inner aspect of the calcified dentinal tubules. Lamina limitans is what? Lamina limitans is what? Thin organic lining present on the inner aspect, organic lining. Lining present on the inner aspect of the calcified dentinal tubules. Now, as it is an organic lining, it is rich in what? Glycosaminoglycans. It is increased GAG, glycosaminoglycans, and its lining is similar to the lining of lacunae in case of cartilage and bone. Its lining is similar to that present in the lacunae of cartilage and bone. So lamina limitans is mainly an organic lining. It is an organic lining present on the inner aspect of the dentinal tubules. Now, which dentin surrounds the dentinal tubules on its inner side? Peritubular dentin. So this organic lining is present in peritubular dentin. Peri, from the word itself, we can say surrounds. So the dentin that is present just next to the dentinal tubules is our peritubular dentin. And here we can have a thin organic lining surrounding this calcified tubules, which is our lamina limitans. And it is high in glycosaminoglycans. Peritubular dentin is also known as intratubular dentin. Why? Because the mineral deposition is on the inner aspect of the dentinal tubules, not on the outer aspect. Intra meaning within. So here the mineral deposition is mainly on the inner aspect of the dentinal tubules. So we have discussed about peritubular dentin along with the lamina limitans. So this can be important MCQ question. Inner lining of calcified tubules, and inner lining is mainly organic, rich in glycosaminoglycans. Now coming to the third question. Cusp of carapallae is seen in. Is it permanent maxillary first molar? Is it permanent mandibular first molar, maxillary canine, or mandibular premolars? So this cusp of carapallae is mainly a supplemental cusp. It is a supplemental cusp. So the correct answer here is it is present in maxillary first molar. This supplemental cusp is present lingual to the mesiolingual cusp. It is present lingual to the mesiolingual cusp in permanent maxillary first molar. Now we should be thorough with how many cusps are present in permanent maxillary first molar. 4 main cusp and 1 supplemental cusp. 4 main and 1 supplemental cusp. So which are the main cusp here? Mesiobuccal, distobuccal, mesiolingual and distolingual cusp. Which is the largest cusp here? Mesiolingual cusp. So this cusp of cerebelli is mainly present lingual to this mesiolingual cusp, and it is known as the fifth cusp. So fifth cusp of cerebelli is mainly present lingual to the mesiolingual cusp. In this diagram, you can easily appreciate. This is from the diagram itself, we can say which is the largest cusp. In this diagram, you can easily appreciate which is the largest cusp. This is the largest cusp, mesiolingual cusp. So this is the lingual aspect now, right? So lingual to the mesiolingual is our cusp of cerebelli. It is our cusp of cerebelli. So first locate the mesiolingual cusp and then you can easily appreciate here the cusp of cerebelli. So this can be asked as an image-based question also. You can be shown this type of diagram and asked identify the structure given in the image. So it is mainly cusp of cerebelli. Here also in this diagram you can appreciate. From the diagram only first you should know which is the mesiolingual cusp, and after locating the mesiolingual cusp you can easily appreciate the cusp of cerebelli here. And this will be the lingual aspect. So it is present lingual to the mesiolingual cusp. Which tooth completes its eruption between 11 to 13 years? Is it maxillary second molar? Is it mandibular second premolar? Is it maxillary canine? Or is it maxillary second premolar? For this, you should be thorough with this table. We have discussed in many discussions, right? That you should be thorough with. You definitely get a question from chronology. So you should be thorough with this table, which is given in Wheeler's for the eruption timing of permanent tooth as well as primary tooth. So here we can see 11 to 12 years. It is for canine, maxillary canine. So correct answer here can be maxillary canine. Seven to 8 is mainly for central incisor, 8 to 9 for lateral incisor. So what will be the eruption sequence for permanent maxillary teeth? It will be 6, 1, 2, right? Then 3. No, here we can easily say that 10 to 11. 4 is before canine. First premolar erupts before canine. So here 4, then 10 to 12 and 11 to 12. So it can be 4, 5, 3, 7, 8. Or it can be both ways. 6, 1, 2, 4, 3, 5, 7 and 8. It can be both ways. Second premolar can come before canine or it can come after canine. Anyway. So you should be thorough with this table. You can be asked about the root completion also. You can be asked about first evidence of calcification also. Right? Now coming to our next question. Elevated occlusal portion of the tooth which forms the developmental grooves is it ridge? Is it cusp? Is it fossa? Or is it tubercle? It is an elevated occlusal portion which forms developmental grooves. So, ridge is elevation, but it is a linear elevation present on the surface of it is just a linear elevation. It is not whole occlusal elevation. It is just a linear elevation present on the surface of the tooth. So it is linear elevation. And it's is basically named on the basis of its location. If it is present on the mesiobuccal cusp ridge, triangular ridge, right? So it is mainly named according to its location. Marginal, if it is present on the margin, it is marginal ridges. If on the mesial side, mesial marginal ridge. If on the distal side, distal marginal ridge. So ridge is mainly a linear elevation and it is named based on its location. Coming to fossa. Fossa is again a depression, an irregular concavity or depression. So it is not a elevation. So again, this is not a correct option. Tubercle is also not a correct option. So correct answer here is cusp. Correct answer here is cusp. So what is cusp? Cusp is also an elevation, and in between this cusp we can easily appreciate the grooves present. Groove is again a shallow depression present between the primary parts of the tooth. Recently we have seen mandibular second premolar diagrams. In that, lingual groove was separating two lingual cusp, right? So same applies here. Elevated occlusal portion, so cusp are elevated. Occlusal portion, they are elevated. Occlusal portion which forms grooves, they are separated by grooves. Here we can see elevated surface and centrally we can see the presence of groove. Here also in this diagram we can easily appreciate these are the two cusps and centrally we can see the separation by a groove. So the correct answer here is cusp. Now coming to our next question. Smallest cusp of mandibular first molar. Is it distal? Is it distolingual? Is it distobuccal? Or is it mesiolingual? First of all, we should know mandibular first molar has how many cusps? 5 cusps. Right. 3 buccal, 2 lingual, mesiobuccal, distobuccal and distal present on the buccal surface. 2 lingual, mesiolingual and distolingual. Here we can see this is the buccal aspect. So mesiobuccal, then coming to distobuccal and then distal. This is the lingual aspect. So mesiolingual and distolingual. So here in this diagram, we can easily appreciate that the distal cusp is the smallest cusp here. Distal cusp is appearing smallest here. As we can see, mesiobuccal and distobuccal are larger as compared to the distal cusp. Even our mesiolingual and distolingual cusp are also larger than the distal cusp. So, the smallest cusp in mandibular first molar is distal cusp. Mesiobuccal is the largest, followed by mesiolingual and distolingual, then distobuccal, and smallest will be our distal. Now coming to our next question. Overjet is defined as, is it horizontal overlap? Is it vertical overlap? Is it transverse plane discrepancy? Or all of the above? Now, what is horizontal overlap and what is vertical overlap? Right. Vertical overlap is mainly of maxillary incisors over mandibular incisors. Vertical, maxillary incisor over mandibular incisors. It is 1 to 2 mm. It is known as overbite. Relation of maxillary incisor over mandibular incisor. It is known as overbite. It is about 1 to 2 mm. In this diagram also we can easily appreciate this relation is overbite. Relation of maxillary tooth over mandibular tooth. Now coming to horizontal overlap. It is mainly over jet. It is known as over jet. It is horizontal relation. It is generally 1 mm and 3 mm. So this relation is over jet. Horizontal relation between maxillary and mandibular tooth. The space between the maxillary and mandibular tooth. So it is over jet. So over jet is what? Now coming to our question, is it horizontal relation or is it vertical relation? These two are not the correct answer here. So remaining from this horizontal overlap and vertical overlap, we have to decide. So overjet is mainly horizontal overlap. It is not vertical overlap. Vertical overlap is mainly overbite. It is mainly overbite. So the correct answer is horizontal overlap. Coming to our next question. Odontoblasts are derived from ectoderm, mesoderm, endoderm or neural crest cells. In our lectures, we have discussed which lectures? Tooth development lectures. Right? That all the structures which are derived from dental papilla, dental sac, derived from neural crest cells, except enamel. The remaining tooth structures are derived from neural crest cells. Except enamel, the remaining structures, tooth structures are derived from neural crest cells. So odontoblasts definitely form what? Odontoblasts are which cells? dentin forming cells. So as they are dentin forming cells, dentin is basically derived by neural crest cells. So all the tooth supporting structures as well as tooth structures are derived from neural crest cells except enamel. Connective tissue components such as fibroblast, odontoblast are mainly derived from neural crest cells. Neural crest cells can give rise to array of tissues such as connective tissue of face and skull, cranial nerve, odontoblast cells, melanocyte cells. So they can differentiate in wide array of cells. So the correct answer here is neural crest cells. Dental papilla gives rise to, this also we have discussed many times. DP, dental papilla gives rise to D and P. Always remember D and P. D, dentin, and P, pulp. So dental papilla cells under the influence of amyloblast cells differentiate into odontoblast cells forming dentin and pulp. So the correct answer here is dentin and pulp. Dental papilla cannot form pulp alone. It forms pulp as well as dentin. Pulp and periodontal ligament? No. Because PDL is derived from dental papilla? No. It is derived from, periodontal ligament is derived from dental sac. So again, this is not the correct answer. And all of the above cannot be the correct answer. So the correct answer here is pulp and dentin. As dental papilla cells differentiate into odontoblast cells forming dentin. And fibroblast present, they differentiate into pulp, form pulp. So in this chart also we can easily appreciate dental papilla differentiate into odontoblast cell, they form pulp. Then fibroblast cells present in dental papilla form pulp, and remaining cells differentiate into odontoblast and they form dentin. Enamel organ gives rise to enamel. They differentiate into amyloblast cells and form enamel. While dental follicle, here also previous question is also answered in the same chart. As we can say, ectomesenchyme is mainly derived from neural crest cells. And this ectomesenchyme forms what? Dental papilla and dental sac both. So the structures which are derived from dental papilla and dental sac are indirectly derived from neural crest cells. So we are getting answer of 2 questions from this chart. Previous question as well as the current question. So dental papilla, D and P, dentin and pulp, and dental follicle gives rise to cap, cementum, alveolar bone and periodontal ligament. Cementum, alveolar bone and periodontal ligament. So enamel organ gives rise to enamel, dental papilla, dentin and pulp, and dental sac or dental follicle gives rise to cap, CAP, cementum, alveolar bone and periodontal ligament. And mainly enamel is formed from the ectodermal portion, while ectomesenchyme is derived from neural crest cells. And which is the ectomesenchymal portion? Dental papilla and dental sac or dental follicle. Now coming to our next question. Pericymata are the external manifestations of, is it enamel rod? Is it incremental lines of Retzius? Is it Nismith's membrane or is it pellicle? So Perikymeta are mainly external manifestation of striae of Retzius. Striae of Retzius. Enamel rods are the structural unit of the enamel, right? Incremental lines of enamel are known as striae of Retzius. And perikymeta are the external manifestation of this striae of Retzius. What is Schmidt's membrane? It is primary enamel cuticle covering the surface of the newly formed teeth. It may be lost by mastication. So it is primary enamel cuticle. So definitely it is a surface structure. It is covering the surface of the tooth, protecting the tooth from the surrounding connective tissue once the tooth is completely formed. So it protects the tooth. It forms a protective covering over the tooth. It is also known as primary enamel cuticle. So it is not the external manifestation. Enamel rods are also not the external manifestation. Pellicle, again, it is a surface structure. It is also not the external manifestation. Perikymeta are mainly transverse wave-like grooves believed to be the external manifestation of striae of Retzius. So in this diagram, we can see these are our striae of Retzius, and externally, these structures which are seen are perikymeta. So the striae of Retzius are ending on the surface of the tooth are known as perikymeta. So they're basically the external manifestation of striae of Retzius. Here we can see the perikymeta are parallel to each other. We can easily appreciate they are parallel to each other. They're more near the cemento-enamel junction. So they're parallel to each other as well as to the cemento-enamel junction. So these are mainly our striae of Retzius here, and their ending we can easily appreciate as external manifestation of striae of Retzius. Parallel to each other as well as to cemento-enamel junction. So perikymeta transverse wave-like groove. Here we can see there are transverse wave-like grooves believed to be external manifestation of striae of Retzius. They are also known as imbrigation lines of Pickerel. This can also be asked as an MCQ question. Other name for external manifestation of striae of Retzius is imbrigation lines of Pickerel. It is imbrigation lines of Pickerel. Now coming to our next question. All are hypomineralized except enamel spindle and enamel tuft. It is asked except, not which are hypomineralized structure. It is asked except. So enamel spindle and enamel tuft are definitely hypomineralized structure because they contain organic material. So they are not hypomineralized. Enamel lamella and enamel tuft, they are again hypomineralized structure as they contain organic material. Enamel tufts contain hypomineralized enamel rods. Enamel lamella is also having organic material present. Enamel prism and surface layer. So this can be our correct answer. Neonatal line? No. So the correct answer here is enamel prism and surface layer. What is surface layer? It is mainly a structureless layer of enamel. structureless layer of enamel known as prismless enamel. It is present in 70% of the permanent tooth and all deciduous tooth. 70% permanent and all deciduous tooth. Structureless layer known as prismless enamel. It is least often found over the cusp tip and most common towards the cervical area of enamel surface. Cervical area of enamel surface. No prism outline are visible, only apatite crystals will be there. They will be parallel to each other and perpendicular to stria of Retzius. So, apatite crystals will be there parallel to each other and perpendicular to the stria of Retzius. They are heavily mineralized. So, they are hypermineralized structure than the bulk of the enamel found beneath it. So, it is the surface structure. Again, it is prismless structure. It is structureless. It has only apatite crystals being parallel to each other as well as perpendicular to the stria of Retzius. And it is heavily mineralized. So, definitely here our answer is enamel prism and surface layer. Now coming to our next question. Most widely accepted theory of dentine sensitivity. Is it direct neural stimulation theory? Is it fluid or hydrodynamic theory? It is transduction theory or vascular pressure theory? Vascular pressure theory is not a theory of dentine sensitivity. It is a theory of eruption, right? So this is not the correct answer. It is out of the league here because it is a theory of eruption. Now these three are main theories of dentine sensitivity. Among these three, which is the correct answer? Fluid or hydrodynamic theory is the correct answer. Why? In direct neural stimulation theory, directly the nerve endings are stimulated, right? And the nerve endings are mainly present only on the inner aspect of the tubule, not on the outer aspect of the tubule. So even if L is sprayed, then it has effect only on the inner aspect, not on the outer aspect. So this theory cannot be accepted as the nerve endings are present only on the inner aspect. They're not present on overall portion. They are present only on the inner aspect of the tubule. So direct neural stimulation theory is not widely accepted. Fluid or hydrodynamic theory. This is accepted because the sensitivity is based on the movement of the fluid. If hot or cold stimulation is given, if someone drinks hot tea or an ice cream, so based on the hot and cold stimulation, there will be movement of the fluid which will conduct the impulse to the nerve endings, and then we can feel the sensitivity here. So various stimuli, mainly hot, cold stimuli, what will? It will affect the fluid movement. Dentinal tubules contain what? Dentinal fluid, odontoblastic processes. So there will be movement of the fluid based on the stimuli, that is maybe heat or cold stimuli. This fluid movement may be either inward or outward, which stimulates the pain mechanism in the dentinal tubules by mechanical displacement of the fluid, and this fluid will send signals to the nerve endings present on the inner aspect of the dentine. So even if the nerve endings are not present on the outer aspect of the dentine, but because of the fluid movement, the nerve endings will be stimulated and will conduct the impulse. In transduction theory, it is said that odontoblastic processes are stimulated and then they conduct impulse to the nerve endings. But odontoblasts do not have neurotransmitter vesicles or synaptic junctions, so it can transmit the pain. So this theory is also not accepted. Only the current theory is fluid or hydrodynamic theory. Because of the movement of the fluid, inner nerve fibers will be stimulated. The nerve fibers on the inner aspect of the dentin will be stimulated. So it doesn't require nerve fibers on the outer aspect of the dentin. That's why fluid or hydrodynamic theory is widely accepted theory. Because of the stimulus, movement of the fluid. Inward or outward movement of the fluid. Now coming to our next question. Butt joint in cemento-enamel junction is seen in how many percentage? 10%, 30%, 60% or 90%? What is butt joint? It is mainly edge to edge or sharp junction. It is mainly edge to edge or sharp junction between enamel and cementum. So this is enamel, this is cementum, this is butt joint, sharp junction between enamel and cementum. So butt joint is mainly sharp junction or edge to edge junction. So it is seen in mostly 30%. It is seen in 30%. So correct answer here is 30%. So butt joint is mainly sharp junction or edge to edge. Where enamel meets cementum at a sharp point. It is mainly in cases of 30% of all teeth, while 10% have gap type. Gap, from the word itself we can say there's a gap between enamel and cementum. They do not meet. This gap type is mainly because of what? Delayed disintegration of HERS. It is mainly because of delayed disintegration of HERS after radicular dentine formation. So here we can see in this diagram there is a gap present. This is enamel, this is cementum, and this is the gap present here. So this is gap junction. It is present only in 10% of the cases when there is delayed disintegration of HERS. If HERS will not disintegrate, dental follicle cells cannot come in contact with the newly formed dentin and they cannot differentiate into cementoblast and form cementum. So we need disintegration of HERS at a proper time. But if it is not disintegrated, no cementum will be formed and there will be a gap. So gap junction is mainly because of delayed disintegration of HERS, Hertwig's epithelial root sheet. And 60% of the cases we have overlap junction. Cementum overlaps enamel. Here we can see enamel and cementum. Cementum is overlapping enamel. This happens when reduced enamel epithelium, that is covering the crown portion of the tooth, slightly degenerates at the cervical portions. It degenerates at the cervical portion. So the surrounding connective tissue comes in contact with the disintegrated portion and form cementum over there. So this is overlap junction. So gap is mainly because of delayed disintegration of HERS and overlap is because of disintegration of reduced enamel epithelium, permitting the connective tissue to come in directly contact with the enamel surface differentiate into cementoblast and form cementum here. Right. So this is our tooth, which is protected with a layer of reduced enamel epithelium. But here in the terminal portion, there will be disintegration of reduced enamel epithelium, and connective tissue cells will directly come in contact with the tooth surface and form cementum here. So this is overlap junction. So remember this: 30% sharp, 10% gap, and 60% overlap junction. Lastly, flush terminal plane is it a normal feature of deciduous dentition? A plane where distal surface of maxillary and mandibular dentition come in same plane, or is it maxillary, deciduous molar ahead of mandibular molar, both A and B? So definitely flush terminal plane is seen in deciduous dentition, so this is correct. Now coming to the second option, plane where distal surface of maxillary and mandibular second molar are in same plane. So this is also correct. So both A and B are correct. So our correct answer is D. So you should know what is flush terminal plane. What is flush terminal plane? It is mainly the relation between the distal surface of deciduous, maxillary and mandibular second molar. Here we can see this is the second molar tooth, maxillary and mandibular tooth. So they are within the same line. Here you can easily appreciate that it is within the same vertical plane. So distal surface of maxillary and mandibular second molar lies within the same plane, same vertical plane. It is an ideal relationship in case of primary dentition. Mesial step, from the word itself, mesial. So the distal surface of mandibular second molar is placed more mesially as compared to maxillary molar. Here we can see in flush terminal plane both are at the same level. Now assume that this is the distal surface and this is the mesial surface. So obviously this side will be the mesial side. So now in mesial step we can see what distal surface is going more mesially. It is going more mesially as compared to distal surface of maxillary molar, right? It is going more mesially. So here it is mainly the relationship between the distal surface. Distal surface moving more mesially, mesial step. Distal surface moving more distally, it will be distal step. Here we can see this is the distal surface, this is the mesial surface. This is the distal surface, this is the mesial surface. So in distal step, what we can see that distal surface is more distally as compared to maxillary molar, right? Distal surface is more distally of mandibular second molar. The distal surface of mandibular second molar is placed more distally as compared to maxillary molar. In this diagram, we can easily appreciate this side is mesial, this side is distal. So distal surface is placed more distally. So it is distal step. So correct answer for flush terminal plane here is D, that is both A and B. It is a part of deciduous dentition and it is mainly a relationship between the distal surface of maxillary and mandibular molars. So distal surface more mesial as compared to maxillary tooth. While in case of distal step, distal surface of mandibular second molar is placed more distally. to the distal surface of maxillary second molar. This diagrams can also be asked as an image-based question. You can be asked relationship between maxillary mandibular deciduous second molar. What is its relation? Is it flush terminal plane? Is it mesial step? Is it distal step? So you can say it is a flush terminal plane. If this type of diagram is shown, then if the distal surface is more mesially, then it will be definitely mesial step. And if this type of diagram is shown, then it is definitely distal step, because distal surface is placed more distally. So we discussed dental histology as well as dental anatomy questions. Thank you.